Thank you so much for inviting me to talk about shin splints. I'm Dr. Dan Benson, and I own Forefront Physical Therapy in South Lake Union. And shin splints is a really common issue that we see in my clinic. It's actually so common that I ended up creating an entire course on shin splints in runners, and I'll talk more about that at the end of this presentation. Let's go through the learning objectives. Number one, by the end of this presentation, you should be able to define shin splints. Number two, you should be able to clearly understand the basic biomechanical causes of shin splints. Number three, you should be able to learn and implement 3 to 4 quick fix strategies. Number four, be able to identify the primary running technique issues that commonly cause shin splints. And number five, learn and implement 3 strength drills to help athletes with shin splints get better. If you were to go through the entire course, then the 6th learning objective would be to understand and be able to apply the Forefront Injury Recovery Framework to ensure your athletes fully recover from their shin splints. What are shin splints? Shin splints, also known as medial tibial stress syndrome, are caused by inflammation and muscular traction on the periosteum and stress reactions in the bone. So this is both a soft tissue and bony issue, and it's a function of too much stretching and repetitive stress to the anterior medial aspect of the tibia. Biomechanically, the cause of shin splints is usually uncontrolled foot pronation. And just as a note, we never want to block foot pronation, with rare exceptions. So for example, if you're really trying to optimize glute activation, sometimes it makes sense to fix the foot in a single position so the arch is lifted and the foot can't pronate and you drive all the motion up the chain into the hip and glute. But in general, the goal really should be, can we control foot pronation? And it's a function of the rate and range of motion, so the sequencing of how the foot moves in and out of foot pronation that really matters. Every single one of us ideally would pronate when our foot hits the ground. So ideally we want to be able to use pronation, but use it appropriately. So shin splints can occur in individuals with high arches. They don't necessarily have to have uncontrolled foot pronation to end up with shin splints. It's far less common, but we do see that in our clinic. Just in case you aren't totally clear on what foot pronation really looks like or exactly what's happening in the foot when it pronates, basically, whether or not you're a heel striker, there's going to be a mix of forefoot inversion, so the first ray dorsiflexes and rotates up, along with the nearby second and third rays as well. And at the same time, the heel is going to evert and internally rotate. And so it's a combination of really those planes of motion that result in pronation. And so when that occurs, the arch drops, the tibia and fibula rotate down and in, and you get ideally a nice soft cushion to help absorb impact every time your foot hits the ground. All right, so a model might be helpful to check out the actual biomechanics behind most shin splint cases. So let's say foot is entering into the ground. This is the right foot. Foot enters into the ground. A pronation moment will occur. So rear foot everts, internally rotates, forefoot externally rotates and inverts. And it's the combination of those movements that collapses the arch, and the tibia starts to move forward, sideways, and rotate in. And so if the knee is lagging a little bit because this rate occurs way too fast and uncontrolled, you'll see that the tibia starts to bow in the sagittal plane, and it also starts to bow in the frontal plane as the foot and the arch collapses. And it's the combination of those two planes of motion, sagittal plane, frontal plane, and some rotational transverse plane, that creates a big anterior medial stress to the tibia. And the surrounding structures, including anterior tibialis, all get angry because they're being stretched too far too fast. They're trying to decelerate that stretch, and it's just too much tension through too big of a range of motion. So here are some rescue and quick fix strategies. The very first strategy that you can implement is an anterior tibialis strength strategy. It's not functional, and it should not be considered a long-term fix, even though a lot of people will feel better just by strengthening their anterior tibialis. So you got to be careful that you don't just get them doing this one exercise and then they think they're better after doing this for a few days and just let them go. There's a lot more to fixing shin splints than just re-strengthening the anterior tibialis muscle. So just be careful. Here's the video on that. Okay, so not a very functional way to strengthen the anterior tibialis, but it's typically pretty safe because it's so isolated and you can easily control the load and tension. And so the rubber band would go around the forefoot, and then you would attach it somewhere farther away so that you can then pull up against the band repeatedly. And you would do this both with the knee bent, like I'm doing, and then you could repeat it with the knee extended and pull up against the band that way as well. Just again, one quick reminder on this, that it is a very low load. Even if you start using really thick rubber bands, the difference between a rubber band versus ground reaction forces, meaning your body weight and gravity driving your foot into the ground, is way greater than what a rubber band can replicate. So again, even though you'll feel a really healthy burn and you might burn out after like 15 reps of something like this, it's only going to get you so far. And again, it can make athletes feel much, much better, but it should not be considered the end fix. All right, here's another quick fix strategy for athletes with shin splints. Cupping can be an awesome way to bring blood flow to the area, to desensitize and to make things better, feel better quickly. So there are a couple different strategies in terms of how you use this that I'm going to show you. The first way is relatively static. It's the most common way to use cups. And so all you do is get a little lotion, put it onto your shin, all over the shin really, medial, anterior, lateral aspects. And then you'll put some lotion directly on the rim of the cup to try to help it stick better. And then you'll apply the cup, and then you'll move it all over. So up and down, all through the front, the anterior lateral compartment over the anterior tibialis, all the way down toward the ankle. And you could leave it in place for 15 to 30 seconds at a time. You need to warn your athletes that redness is normal. Sometimes you'll have like a red cup mark for up to 3 to 5 days. Some people don't get any marks. Some people, the marks can last weeks. But anyway, make sure your athletes are prepared for that. That's the relatively static, non-functional way to do cupping. It's the most common way to do cupping. The more dynamic and more valuable way to do cupping is to apply the cup to the most sensitive part, if the athlete can tolerate it. So I'm gonna get a little bit more lotion, and we're gonna pretend like this part of my tibia is especially sore. So I'm gonna put the cup on and leave it. And now we're gonna layer on a more dynamic movement pattern. And so this movement pattern is going to be a 3-dimensional single leg squat, and it's a glute optimized 3-dimensional squat. So what it's gonna look like is this, and I'll show you from a few different angulations. I've got all my weight on my left heel so that my anterior tib doesn't get as much stress. So weight's back on my left heel, right foot is a light toe touch. I'm gonna pull my butt back in space, I'm gonna throw my butt out to the left and turn to the left. This 3-dimensionally stretches my left glute. I'll show you from this side as well. So butt goes back, it flexes, adducts, and internally rotates. And this creates a huge stretch to my glutes. So there's tons of potential energy. It's the same 3-dimensional biomechanics that my hip should go through every time my foot hits the ground, whether I'm walking or running. And if these 3-dimensional biomechanics work really well, it's also a momentum decelerator for foot pronation. So you get to target a lot of things at once just with this one single exercise. But you can play with this. You could have the cup on while people walk on their heels, so get a little anterior tib activation, or walk on their toes for calf activation. The cup will fall off over and over. You'll have to keep putting it back on. You could do lateral lunges with the cup on. Feel free to be creative, but also really specific. So we try not to leave the cups on for more than a couple minutes. Each person is a little bit different, so usually we'll start for maybe like 15 to 20 seconds, take it off, make sure they're not too red and the skin hasn't broken down too much. And if things look good, you could again leave it on for up to 2 minutes. People with really sensitive skin, usually we won't leave it on for more than 15 seconds. This is an awesome strategy to give a try. So arch supports and foot orthotics. This can be another great quick fix recovery strategy. The Caveat is that most people don't need arch support or orthotics. And it's interesting that I say that because we make custom orthotics, but we convince most of our patients not to get them. It's actually probably the most lucrative thing we can do in my business. And we tell most people not to get them because the majority of people, if you train the foot and the hip properly, they do not need orthotics. But as a short-term strategy, yes, it can be super helpful. And so if your athlete has just a ton of trouble decelerating and controlling foot pronation, they may be somebody who needs an added assist for a very clearly defined period of time. Usually that's somewhere around 2 to 6 weeks. In certain cases, we'll have patients who we tell them that they need either custom orthotics or insoles for up to 6 months. But most people, it's a very short period of time, especially if they're working on foot and hip biomechanics at the same time. But again, people who have lots and lots of pain, lots of trouble controlling their foot, this can be a game changer for short-term use. Okay, so here's one more quick fix strategy. So for your athletes who can tolerate more stress and load to their shin, foam rolling can be super helpful. So if you get the shin on the foam roller, starting with support from both your hands and the unaffected leg, you can roll through anterior shin muscles, so like anterior tib, and you can go through the whole chain all the way down to the ankle. If you hit a hot spot, pause and pump your foot or do some rotations over the top. Ideally, you want to try to pin the really tender areas and get them to release. Sometimes they won't release the first few times you do this, but if you work at it consistently each day, things do tend to ease up in terms of tenderness. But you also want to have the athlete roll more onto their side and get right into that medial aspect of the tibia, right along that border. And so it's both on the bone as well as the calf muscle, the edge of the calf muscle. And that can be super tender for a lot of athletes. And same thing, if you hit a tender spot, pause, pump. If it's too sensitive of tissue, your athlete will know pretty quickly. They'll do that exercise, and instead of immediately feeling better after foam rolling, they'll tell you that it's a little bit more tender, more bruised in terms of how it feels. So you'll be able to figure that out pretty quick. There's a sweet spot when foam rolling can be especially helpful. So sometimes this strategy has to be delayed for a little while. But in addition to foam rolling the shin, you can also get right on a really hot spot in the shin and then pause, and then at the same time dig into the calf. And so you can pin both shin and calf at the same time. And again, you can roll into different kind of angulations around that area while you're pinning and pumping. And that can rapidly help desensitize and make things feel better. If your athlete isn't in too much pain, ideally it's a great idea to film them while they run. You can learn a lot about running technique issues if you film from the front, the back, and from the sides. A few of the things that you really want to look for are, one, are they supinating during laid stance? So as their, for example, left foot is coming through and they're pushing off with their right leg, is their heel inverting? And I'll show you what that looks like on the model again. So during laid stance phase, just as the heel is about to come up and as it comes off the ground, the heel should be inverting, so it tilts in. And at the same time, the front of the foot is everting, and the first ray in particular is plantar flexing. And so that's what creates a supinated foot. When your foot supinates, it becomes rigid. It becomes an awesome lever to propel from. And so that's something that you're really trying to look at from the backside view as they're running away from you. You can check that with walking too, but especially when they're running, make sure you see that heel invert. And you can see it even if they have shoes on. You should be able to see the shoe rotate in space along with their heel. Another thing to look at with running is to make sure that when your athlete's foot enters into the ground, that you don't see excessive hip adduction, meaning you don't see, for example, if they land on the right foot, you don't see the left hip collapse really far down and the right hip drive out to the side. That would be a very clear sign that in the frontal plane, the glute has trouble controlling the pelvis. Additionally, at foot strike, if you see the knee collapse toward the inside, usually you'll see that because the foot is overpronating and or because of uncontrolled motion up at the hip. that's also a problem. And so you'll see a combination of knee abduction and hip adduction very often. And that's typically just a function of really specifically retraining glute strength and ideally foot strength as well. Other thing to look at is that toe off. So as the foot is coming off the ground, is that one, the foot doesn't rotate out into a massive external rotation heel whip. You'll sometimes see the foot really torque out like this as they lift their foot up off the ground. Oftentimes that's an issue in terms of mobility up the chain into the hip, and or the foot is just so stuck in pronation throughout stance phase that finally as the heel comes up off the ground, everything can just unwind and you see this giant outward rotation of the foot. That's something that can be trained or retrained for running form. And so it's not just at the foot coming off the ground. You want to make sure that everything is very linear, so there's none of the foot swinging out to the side or knee going out to the side. With track in particular, things need to be very linear throughout the entire cycle of movement. So just having them practice in front of a mirror, something like what I'm doing, even that can be a very simple basic exercise to start practicing hip, knee, foot, all in a linear alignment. And then one more running technique, form issue that we often see with runners who have shin splints is this big time rotational arm swing. And that rotational torque from the top down can lead to more uncontrolled motion and rotational torque down into the foot and all the way up into the shin. And it's kind of a fun experiment if you're ever bored, if you have your athletes run with their arms going big time in the transverse plane, so lots of rotation in the transverse plane rather than, or versus more efficiently, a lot of rotation in the sagittal plane, you'll actually see people be less efficient, their times will be slower, and actually they'll be taking fewer steps per minute as a result of that rotational torque versus the runners who are more efficient and elbows and arms are pumping far more in the sagittal plane. So food for thought on that. Also, we've been seeing a lot of runners who are keeping their hands super low when running. That's also a problem. The farther that the hand is from the shoulder, the more rotational torque that they're dealing with. That can also be an inefficiency and actually lead to fewer steps per minute. And as long as I'm talking about steps per minute, there's some debate about this, but for the most part, if you look at all the top athletes for distance runners, as well as longevity in terms of their top performance, the runners who keep up a higher steps per minute, meaning around 175 or higher, often end up being the runners who stick around the longest and win the most races. So steps per minute matters. Once you start getting into your athletes who are doing shorter, faster races, the steps per minute, there are calculators for this. You can try to figure out how many steps they should be taking for a 100-meter sprint, for example. But those numbers start to change pretty quickly depending on the distance of the race. So food for thought on that. These are the three main exercises that each of your runners with shin splints should be able to do. So the first one is a glute optimized stability single leg squat. I know that's a mouthful, but I'll show you what it looks like. Ideally, you'd have the athlete hold on to something so balance isn't part of the equation. And yes, this is one of those few times where we actually are trying to block foot pronation. So we're going to ask the athlete to actively lift their arch and subtly turn their stance side knee out. So in this case, I'm on my left leg. I'm lifting my left arch up and I'm turning my left knee out to the left a little bit. And now I'm keeping my right hip up, right foot floating out to the side. Again, I'd be lightly holding on to a wall with fingertip support. And it's glute optimized because my knee bends, but it only bends because my butt goes back in space. So traditional or a quad optimized squat would look like this, where my knee comes forward, I'm staying pretty tall. But for the sake of quickly making changes to the glute and the glute strength, you're going to optimize that glute function by hinging and pulling the butt back. I'll show you from a few different angulations just so you can see what this looks like. Again, on my left leg, my knee doesn't really come forward. I'm keeping all my weight on my heel. And if you do this right, very, very quickly, you'll feel a ton of work in your glute. So that's exercise number one. Exercise number two is a three-dimensional heel raise matrix. And so what that'll look like, I'll show you from a couple different angulations, is heel raises where you are going up on your toes with, in this case, my right leg swinging in the sagittal plane. So every time it gets to the end of the swing, I'm going up on my toes. Now frontal plane, my right foot points forward the whole time. Again, heel raise at the end of each swing. And then transverse plane, my foot turns in, turns out, heel raise at the end of each plane of motion. So just from the back, I'll show you again, this time on my right leg. So forward and backward swings with my left leg, that's sagittal plane. Side to side with my left leg, that's frontal plane. And then rotationally, that's transverse plane. And if your athlete can do 10 reps, 20 reps total in each plane of motion, that's 60 reps. If they can do that, their foot and calf complex is going to be pretty strong regardless of the angulation that they're moving through. And that can be a really great foundational exercise to make sure strength is right where it needs to be to help push off as well as decelerate ground reaction forces. All right, so the third exercise that your runners should be able to do, and this is really kind of the litmus test. Once they're able to do this three-dimensional single leg hop matrix without any pain and with quite a few repetitions, you'll know that they are ready for quite a bit of impact with their training, meaning they can get back up to full workouts, full intensity, full volume, probably pretty safely. If they can't do this exercise pain-free and with a lot of repetitions, it probably means they should be not fully ramping up to full. It probably means that they should not be ramping up to full intensity and volume. They'll need to pare it back until this feels totally fine. So this is what it looks like. For example, if I'm on my left leg, sagittal plane single leg hops would be forward and backward. I'll show you from the side. So forward and back. And then frontal plane hops would be side to side. And then transverse plane hops would be twisting in space. And again, if your athlete can do 15 to 20 seconds in each plane of motion on each leg, and it's totally pain-free, they're probably ready to start pushing things again with their workouts. As I mentioned, I created a course, a really in-depth course on shin splints, and it covers the forefront injury recovery framework, which includes soft tissue strategies, way more in depth than what I took you through with this presentation. It also covers mobility and flexibility strategies, as well as strength and neural input strategies. And there are tons of videos, and this is all algorithmically based. And so each exercise kind of builds and becomes increasingly progressively challenging. And if your athlete goes through this entire course, it's almost guaranteed that they're going to get better. 99% of our patients that we've seen in the past could have gone through this course on their own and gotten better. This is targeted toward you guys. So as professionals, it's something that you can take a look at. Again, it might take 2 to 3 hours to get through, but it's really, really in depth, lots of great information, very specific videos on how to do specific exercises with your athletes, what you should be looking for to make sure that they have the strength and control mobility exactly where they need it. And on top of this course, we also offer virtual visits. And what we've done in the past is we've had an athletic trainer, for example, with their athlete on the virtual call together. And so we work as a team with the virtual call to make sure that the subtleties that are holding that athlete back really get addressed. And the nice thing about having you, the professional with the athlete, is that you can help fine-tune the analysis that I'll need to take the athlete through. And at the same time, you'll also be able to help guide the exercises as well as retain the thought process that's going to be necessary to make sure you can get your athlete 100% better. A lot of times we'll do somewhere around 1, 2, or 3 virtual visits with this group setting. Every once in a while it takes more. We've done up to 6, but it's something to think about. And so the nice thing is it can be convenient for the athlete because they don't have to drive and go to a number of in-person physical therapy visits. And if you're already working with this athlete, you're on the exact same page as the athlete in terms of what needs to be done to get them better. So just something to think about. The course that I mentioned, it can be found at injuryrecoverymadeeasy.com. For the next month, it'll be $50. And then thereafter, we'll bump up the price to the usual $250. So anyway, I really appreciate this opportunity to get to talk to you about shin splints, something, again, that we see all the time in the clinic because we work with so many runners. And if you have any questions, you can always feel free to email. I'm happy to respond.